The following program is sponsored by Community Psychiatric Centers and is produced for educational purposes only. It is not intended as a substitute for medical or psychological advice, diagnosis, or treatment. The content should not be used for self-diagnosis or treatment of any health-related condition. As always, seek the advice of your healthcare provider with any questions regarding a medical or mental health condition.
Welcome to Community Psychiatric Centers Presents. Tonight we're talking about a condition that affects 2 million American children. It's called ADHD, or Attention Deficit Hyperactivity Disorder. Children who have it have a hard time controlling their behavior and or paying attention. To help us fully understand this condition and what can be done to help, let's meet our experts. Dr. John Carasso is Clinical Director of Community Psychiatric Centers. He's a clinical licensed child psychologist and a certified school psychologist. And Dr. Robert Lowenstein is Medical Director of Community Psychiatric Centers. He's a board-certified child, adolescent, and adult psychiatrist and a fellow of the American Academy of Child and Adolescent Psychiatry. Good evening, gentlemen.
Good evening.
Dr. Lowenstein, let's start with you tonight. First, what exactly is ADHD, and do we have any idea what actually causes it?
Well, ADHD is a chronic, lifelong condition that affects about 5 to 10% of school-aged children. It's first usually diagnosed in younger children, and there are 3 types of ADHD, basically. One type is called ADHD overactive type, in which the child is extremely hyperactive, impulsive, on the go, restless. The second type is called an inattentive type, in which the child is basically unable to attend to their work at school. They don't hear what their parents ask them to do, and they seem to be somewhat distracted. The third type is combined, meaning it has some of each of the 2 that I just mentioned. Children with ADHD, as I mentioned, are extremely hyperactive and inattentive and impulsive. They have trouble in their ability to accept no. They're easily frustrated. They're moody. They have problems with social interactions with other children because they tend to insert themselves into situations where they shouldn't be. They tend to be bossy. They tend to also disturb other children at play and disturb children in the classrooms. The causes of ADHD are somewhat unknown. There are lots of theories about it. We do know that it's a familial condition. There's a high rate of it in families. If one parent has ADHD, their child might have a 25% chance of having it. We think that ADHD is due to some form of brain abnormality in which those parts of the brain which deal with helping to deregulate sensations, to dampen sensations and impulses, is not working properly. And structural abnormalities of the brain are seen in those children with ADHD.
Dr. Carasso, some people might have wondered over the years, are these just a child's personality traits, or is this ADHD? How do you actually diagnose that it's ADHD?
That's a very good question. We're often asked by parents, is there one specific test that does diagnose ADHD, and there's none. On the contrary, we're looking for a comprehensive evaluation that includes quite a number of things: a detailed history of the child's functioning through pregnancy, birth, early childhood, moving into the child's current levels of functioning. That would include home, school, community. Vitally important that we get an assessment of behavior in different domains. We may talk with classroom teachers, call them on the phone, ask how things are going in the school setting, have the teachers and parents complete what are called behavioral inventories, which provide a rating of the child's behavior, severity levels and whatnot. We'll also take a look at assessing the child directly, of course, monitoring during the assessment, how they interact with us, the extent to which they're able to sit in their seat and maintain attention, not be fidgety, complete tasks, have a back and forth conversation. And all of these things together, not just one test, but a combination of things, come together to help us make an accurate diagnosis.
And how long does it take normally to make a diagnosis?
It varies. There are times where we may forego diagnosis right away to try to get more information, have some observations take place. Or we may find that through the assessment of the child at the time of the evaluation, talking with parents, talking with teachers, that we can come up with a diagnosis at that time.
We're talking about ADHD tonight on Community Psychiatric Centers Presents. When we return, we'll take a look at its impact in the classroom. And remember, if you have a question for our doctors, you can log on to their website, cpcwecare.com.
Have you noticed something different about your child lately? Does your child seem withdrawn, unhappy, depressed, or prone to sudden outbursts? Your child may be suffering from a mood disorder, and it may be time to get help. At Community Psychiatric Centers, Dr. Robert Lowenstein and Dr. John Carasso lead a highly trained professional staff that offers mental health diagnosis, treatment, and therapy to children and adolescents. Call 1-877-899-6500 today for a free phone consultation.
Sometimes we joke and say, hey, buckle your seatbelts, because we know that anything can happen that night.
We're always trying to figure out how to get the news to you as quickly as possible.
News is in motion. It is something that never stops, so we never stop.
At Channel 11, there is never a slow news day. We all know the mission, and it's to bring breaking news to the audience, to bring local news to our viewers.
We are there live on the spot with information that you need to know.
Of course it's fast. It's Channel 11 News. It's who we are.
And welcome back to Community Psychiatric Centers Presents. We're talking with Dr. Robert Lowenstein and Dr. John Carasso of Community Psychiatric Centers about ADHD, Attention Deficit Hyperactivity Disorder, tonight. And Dr. Lowenstein, let's talk about it in the classroom. What is the potential impact on students, on teachers, and the classroom as a whole?
Children with ADHD in the classroom are often very impatient. They can't wait their turn. They blurt out answers. They can't sit in their chair. They're often up and about, wandering about. They also tend to distract other children by making loud noises or sounds. They fall behind in their classroom work, and they can't seem to focus on being able to complete classroom assignments. So in general, they're really a disruption in the class. Children that are inattentive tend to be quiet, somewhat isolated, distracted. They tend to blend into the background, so to speak, and they also tend to fail in their classroom assignments.
Dr. Carasso, what are some of the strategies that you might use to help a child in the classroom?
Sure, and keeping in mind that there are a multitude of strategies that may be used. The bulk of them are referred to as behavioral interventions, or behavior management is a common term that's used. And also keeping in mind with that we're talking about managing the behavior of the child, but we're doing that through managing the behavior of the caregivers, the people, the teachers, for example, as well as managing the environment. So we may do any number of things. We may have the child sit closer to the classroom teacher, sit them away from distractions. We may even sit them for a period of time in the classroom setting in a carrel where there's blinders around the desk. Again, ensuring that they're not distracted by, say, a bulletin board that's extra busy or has lots of things on it. We may work with the classroom teacher, having the classroom teacher call on that student more frequently to maintain their attention. Behavioral charts are wonderful in the sense that we may target 2 or 3 behaviors, including attention to task, completing assignments in the allotted time, and the child receives reinforcement stickers, whatever it may be, for completing those tasks. It helps to increase motivation.
Also, children with ADHD tend to do better on a one-to-one, so that if a teacher's aide or a teacher or a TSS worker, if the child has wraparound services, can work with the child on a one-to-one basis, stay with the child to keep them on task, they often tend to succeed rather than fail as long as they have that one-on-one attention close to them. Some of the other strategies are to sit the child in the front row to make sure that children around them are not distracted.
Sure.
How are children with ADHD tend to refuse and avoid doing a lot of tasks that they know they'll fail in. So their self-esteem tends to decline, they seem bored, they seem uninterested, and sometimes they'll act out just to get out of the classroom.
Which is why then we'll work with the student as well, of course, teaching them organizational skills, how to prepare their day, how to establish a routine schedule for themselves, to teach them coping skills as well.
It would seem because of all the diagnosis of this, the teachers would be more in tune with what's happening or what could be happening.
But they are.
But it's still is good to have that extra person in who can help facilitate it. When you talk about wraparound services,
Sure,
that's
sure.
what that
a
is.
TSS worker, a therapeutic staff support worker, can be instrumental in helping a child to stay on task, because sometimes, for some children, those behavioral strategies I was speaking of aren't enough, and there's a need for one-to-one attention to help reinforce all those skills that we try to teach.
And the symptoms of ADHD are not always obvious, particularly in the teenager. If you have a teenager with ADHD, they're not hyperactive generally, they're not jumping out of their seat, they tend to be, again, poorly attentive, distracted, they may appear bored, they may appear angry, they may appear to want to be somewhere else.
And that's where we start getting into behavior problems, because a child, especially in the teenage years, who has struggled in the classroom setting, it's not where they want to be. It's not easy for them at times. And so then that tends to manifest in behavior problems, and again, extra support can help with that.
Do you have to look at a lot of things? Because I read somewhere that even vision problems that a child is having could be mistaken if it's not correctly diagnosed.
Oh, absolutely. Also, there are some conditions such as lead poisoning or a fetal alcohol syndrome child that may present with ADHD type symptoms, or a child born of a mother that's been addicted. They also appear with attentional problems and hyperactivity, which is not specifically ADHD.
Sure, it's vital to have a medical assessment by the primary care physician, is also to rule out, from our side, to rule out other mental health conditions that can look like ADHD. We'll be talking about later on.
Yeah. All right, let's take an email question from one of our viewers. A woman writes, my child's teachers have consistently complained that my son can't sit still and is easily distracted. How do I know if he has ADHD or ADD, and if he does, what should I do?
Well, there really is no difference between ADHD and ADD. They're both pretty much the same thing. ADHD is the current terminology to use. ADD was a terminology that was used previously. However, again, in order to diagnose it, the child does need to have a thorough evaluation considering all of their life domains and how they function both at home and at school.
Because the concerns are that any number of things can cause a child to be off task and easily distracted. A child could be bored. A child could have a problem with a classroom teacher. A child, also we want to assess whether, is this just with one teacher? Other classes he's doing fine, that sort of thing. So there's many things to consider and to roll out in trying to determine what's going on here. And we certainly wouldn't want to jump to conclusions. That could cause all kind of problems.
All right, so there are a lot of layers. We're going to be taking some more emails from our viewers in a few more segments. We're talking about ADHD in the classroom right now on community psychiatric centers. We'll be back with more questions for our doctors right after this.
Do you have a child, adolescent, or teenager who is having trouble at home, in the community, or at school? Call Community Psychiatric Centers for help.
Community psychiatric centers provide psychiatric and psychological evaluations. I also work as a school psychologist. We do school-based evaluations. We provide in-home services, outpatient counseling, medication management, autism special services as well.
When a child is in crisis, when a child is suffering, when a child is in pain, a family is in pain and a family suffers. And our goal is to relieve that pain and find the child where they are and help the family to heal. And that's the basis of our program, is to help families to heal.
For a free phone consultation, call Community Psychiatric Centers today at 1-877-899-6500 and watch Community Psychiatric Centers Presents Wednesdays at 7:30 on PCNC. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
Welcome back to Community Psychiatric Centers Presents. We're talking with Dr. Robert Lowenstein and Dr. John Carasso of Community Psychiatric Centers about attention deficit hyperactivity disorder tonight. And let's go right to another email question from our viewers. My child has been diagnosed, doctors, with ADHD, and I am considering medication, but I am afraid and I'm wondering how it may affect my child. I don't know what to do. What do you suggest?
That's a good question, and we often get this question. I think this parent should know that there have been to date over 200 studies that have been conducted, starting back in 1938 when the first study was done on Ritalin. And these studies have pretty much confirmed the usefulness of the stimulant medications and the safety of them in treatment of ADHD. There are basically three types of medications that are now used in the treatment of ADHD. One are the Ritalin-based compounds, the other are the amphetamine-based compounds, and the third is Strattera. Now there also are some other types of medications that are used if those do not work, and those are used in an off-label way, such as some of the medications used for high blood pressure in adults like clonidine and 10X, as well as Wellbutrin, which has been helpful.
Dr. Carasso, you mentioned that behavioral approaches are tried first before any medication is given at all. What are some of the more common strategies that can be done in the home?
Yeah, sure, and similarly with the classroom-based interventions, there are also a multitude of strategies that can be used in the home as well. Again, looking at typically behavior management, and again, looking at managing the behavior of the child by managing the behavior of the parents and the environment as well. Any number of things we may do. We may work with the parent to help them to work with the child in a calm and reserved manner, as opposed to, well, excessive emotionality can excite the situation and make it even worse. We'll help the parent and the child to work out a routine, a predictable schedule throughout the day, which really helps to promote the child's attention and focus. Discipline as well. Punishment, timeout, loss of privilege. That needs to be something that is consistent and that the parents agree on. We may take a look at behavior charts as well. They're not much fun to do, and at times they can be burdensome for parents, and they can be. But the fact is that they can be very effective, so we'll have parents do those as well. And again, very effective. Again, any number of strategies for the child as well. Teaching them organizational skills, visual prompts and cues, which means like pictures of the child emptying the garbage or something as a visual reminder. Helping the child, teaching them coping strategies to be more organized and to understand the triggers that set them off to be more hyperactive. Dietary things we may consider. Exercise is very important as well. So again, there's a multitude of strategies that can be very effective.
Emotionally, what are the children going through, and what are the parents going through when they're trying to cope with this? It's got to be really difficult for them.
Well, it's extremely difficult for the children. They really often tend to have trouble in in sustaining any kind of friendship with their peers. They have trouble in their homes and being able to sustain a good rapport with their parents. Parents often are quite frustrated by the children's behavior, feel the children are not listening to them, feel the children are being defied when in fact the children are just not able to listen or attend or respond to what's expected of them. They tend to fail in school, they tend to have lowered self-esteem, they may get depressed, they may withdraw, they certainly have social isolation. They may develop other symptoms of other kinds of conditions like oppositional disorder or I mentioned depression.
And the key, though, is that, and the hopeful thing about it is that this condition is readily treated in terms of the symptoms. And children who struggle with this make remarkable progress in terms of being able to complete their task and be far more successful in the classroom environment. And something else that we do, either working with the parents to carry out this task or in outpatient counseling or with mobile therapy through wraparound, is teaching the child social skills, helping them to be able to take turns and have conversations with peers without monopolizing the conversation, and teaching them the skills to help them to be successful. And we have wonderful success with that. Wonderful.
And also the good thing about treatment with medications is that you see immediate results.
Exactly.
The day that you give a child a medication is the day you begin to see improvement.
That fast?
Yeah. That fast.
So it doesn't even have to build up in their system?
Except for Strattera, all the other medications, immediately you'll see response to it, and that's very encouraging. And then if the child responds to the medication with improved attentiveness and decrease in impulsivity, they then can be engaged in all the behavioral programming that Dr. Grosso mentioned.
And parents as well. I mean, the parents using these behavioral strategies can also see very quick improvement. If they're consistent and dedicated, things can turn around.
Right. The important thing is consistency in treatment, consistency in taking the medications, following through with it, and oftentimes these medications have to be taken for years.
I was just going to ask you that because a lot of parents think, well, you know, this might be okay as a stopgap measure, but I don't want my child on this medication for the next 20 years.
Well, maybe a third of the children tend to outgrow the symptoms on their own, but 2/3 fully continue to show these symptoms into late adolescence and adulthood as well.
As an adult, might they completely be over this condition?
They might be, but approximately half of them are not. Half of adolescents who have ADHD go on into adulthood to have symptoms of ADHD in adulthood, which look different than the adolescents.
All right. We'll be back with some final questions for our doctors right after this. And remember, you can always go to their website, which is cpcwecare.com.
As a parent, you want your child to reach his or her full potential. For children with autism, early detection and treatment can make a world of difference in your child's life. At Community Psychiatric Centers, our autism unit is led by two highly trained and experienced mental health professionals, Dr. Robert Lowenstein and Dr. John Carasso. Their expertise in the field of autism spectrum disorders means you and your child will get individualized help you need every step of the way. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
I've been at the station a long time. I've covered a lot of important stories, and I know you want an experienced news team that's been there, covered all the angles.
Live coverage.
The news is important, but what's really important is how it affects you, how it affects me.
Local news.
Many of the stories that we tell affect people's lives, and it's our job to deliver the news that you need day in and day out.
Local news is what we're all about. That's all we do, really. Local news.
Welcome back to Community Psychiatric Centers Presents. We've been talking about ADHD tonight and a few final questions for our doctors. Dr. Lowenstein, what about children who don't respond to a particular medicine? What other kind of help can take place for them?
Well, in general, children do respond to one of the types of medications that we can prescribe for them. For example, if we start the child on a Ritalin preparation and that does not seem to help, or if they develop side effects to that medication, which can include a decreased appetite, weight loss, trouble falling asleep, stomach pains, headaches, those kinds of things, moodiness, then we would either decrease the dose of the medication or switch the child to another medication, such as an amphetamine-based type medication, which then might help the child better. If that doesn't work, then we'll try some of the other medications that are available for children, such as Strattera, which is a non-stimulant medication. Sometimes Strattera is used in combination with one of the stimulants. And then some of the other medications that I mentioned before, such as Wellbutrin, Tenex, and other medications, which in combination or alone can certainly help the child.
Dr. Carasso, what if a certain behavioral approach isn't working? What then?
Sure. We specialize at Community Psychiatric in tailoring the plans to be individualized for the child, and I can't emphasize that enough. There are times during initial assessments with the parents when they will express concerns that they've tried a particular behavioral strategy that they read about or whatever, and it just wasn't effective. And one thing that they come to learn after treatment starts is that these behavioral plans need to be tailored for the child's needs. And so that typically means tweaking it, modifying it, various nuances to the intervention to make it work for that child. And that's what makes the difference. Anybody can say, well, I tried timeout. Well, what does that mean? There's a zillion different ways of using timeout. So it's important to capture what works best for that child.
Let's go back to an email question. Here's one of our viewers. How do I know if my child has ADD? He's not hyper, but often seems to be, quote unquote, off in his own world.
Well, that might be a form of ADHD, which we mentioned, called the inattentive form of ADHD, in which the child might appear somewhat quiet, inattentive, distracted, and off in their own world. The other thing is they may have another diagnosis, so it's important to be able to know what you're dealing with. It might not be ADHD, it might be some other condition such as depression or autism, which might look like ADHD.
Which is why it's so important to talk with classroom teachers, get a sense of what happens over the course of the school day. Because again, as Dr. Lowenstein mentioned, a child who's depressed could appear the same way. A child who's had a recent loss in their life or something that they're preoccupied with for a period of time may have that issue. And again, if the child's 13 years old and this just began last month, well, that's not ADD.
Is there often a lot of debate, even between a psychologist and a psychiatrist over what it could be? Do you always agree right away?
We always agree.
No, we always agree. Certainly, we always agree on camera.
Absolutely.
But no, we actually tend to agree.
No, we do.
From a diagnostic perspective, we certainly always agree, pretty closely anyway. And if you follow what the symptoms look like and you talk to the family, talk to teachers, talk to other people that know the child, you really pretty much can make that diagnosis.
Now, what do you have at community psychiatric centers in terms of programs and treatment for these children?
Sure. Well, again, there's many different types of modalities that may be effective. On one level, there's outpatient counseling that can work with the parent and the child, teaching skills and strategies to them. We discussed earlier wraparound services, which is a service that goes to where the child is, home, school, community. So it provides that individualized support that can be very helpful. And then, of course, Dr. Lowenstein covers medication management.
Yeah. And also, the team approach is very important.
Exactly.
And if we communicate as a team, then we come to really good conclusions, and we include the family in that as part of the team as well.
Yeah, that's the key to it, is that we have very positive outcomes, and that's what we look forward to.
When you talk about that team approach, tell me who all is involved. Give me an idea of some of the other staff members who might be taking part in a treatment program.
Well, if we're providing the wraparound services, it might be the wraparound team, which can be a behavior specialist, a mobile therapist, and a therapeutic staff support type member. We might also include in the team the parents, teachers, case managers, school teachers, and other personnel that work with the child in the community.
And there's not many agencies who have a team inherent within the agency of a psychiatrist, psychologist, master's level staff at the mobile therapist or consultant position, and then bachelor's level TSS positions, all working together to meet the child's needs.
Do you find that schools are being more receptive these days to having people come in and work with students to kind of facilitate their improvement in their treatment?
It does depend on the school to some degree. Some schools are very open to it, others are not. It really is up to the school to make that decision whether they want us in the school.
The vast majority of the time, though, is that when we are invited in, it's a tremendous benefit. Teachers appreciate it. Principals are again, highly appreciative of our efforts, definitely.
All right. And when these children are improving, can you see it, you said, pretty rapidly?
Oh, yes. You can see improvement very quickly, especially when they're started on the appropriate dose of medications, and then also some other treatment program is in place.
All right.
Yes.
Thanks again for being with us. And remember, if you have a question for our doctors, you can always log on to their website, www.cpcwecare.com. We'll see you next week. Thanks for watching.
The morning news doesn't begin at 5 a.m. It begins as soon as the 11 o'clock news ends.
Viewers want to say, what is new this morning as I'm getting up?
Overnight news.
When people are about to head to work or to school, they need to be able to turn that TV on and know what's happening in news, what's happening in traffic, what's happening in weather.
Local news.
No matter when you tune in, we're going to be able to update you on what's happening at that moment.
Channel 11 morning news from 5 to 7 a.m. News coverage you can count on.
Time is precious in the morning.
Trying to sell? Looking to buy? WPXI.com free classifieds. Fast, easy, and free. The best place in Pittsburgh to buy or sell anything and everything, from homes and rentals to furniture and pets, even tickets to shows and sports in town. Stuff you can't find anywhere else is right at your fingertips. Go to WPXI.com free classifieds anytime, anywhere. Free to post, free to browse. The most classified listings in the Pittsburgh area. WPXI.com free classifieds. Fast, easy, and free. Looking for great things to do in Pittsburgh this summer? Go to WPXI.com and click on the Channel 11 Summer Guide. We've got concerts, events, and great family places to go. Send us your summer fun photos with the WPXI.com Sun, and we'll post them online. WPXI.com is your source for everything summer on the web.
For a fabulous evening on the water, reserve your table on the Captain's Dinner Dance Cruise online at gatewayclipper.com or call 412-355-7980.